Iris is we really were able to make it unique to Kane County. So we got a lot of feedback from community members, our community partners who would be utilizing the system, on how we wanted to develop the referral fields and different ways that the system functions. So that was really cool because, again, we were able to really make it unique to our community. So since we've launched Iris, we have 70 different community partners on board that represent various sectors throughout the community. So we have court services on board. We have a lot of the probation officers that are utilizing Iris. We have behavioral health care services, primary care services, parent support, different basic needs such as food, emergency shelter. We have education, we have K through 12 education, we have early childhood education. So we have all sorts of different sectors that you can make referrals to. So, and as you can see from the video, it's just a really easy, streamlined process for making referrals. And this is like kind of a cool example of how it works. So the first referral that I actually made through Iris, it was for a child who was in need of a psychiatric evaluation and medication management. So I made a referral to an organization. The referral was rejected because they actually only provide adult psychiatric services, but they responded to the referral that I made within a few hours. So within a few hours, I was able to see that that was not the right organization for the family. And then I was able to quickly make another referral to a more appropriate organization. And the family then got linked with services. So if you think about, if we didn't have something like Iris, it could take much longer to make that connection. So if the organization would have called me, we could have been playing phone tag. It can take so much longer if we don't have something like Iris to get families connected with the right services that they are in need of. So that was kind of cool just to see how quickly we were able to connect them with services. So far, we've been able to collect some data, and 94% of the referrals that have been made through Iris have been accepted. So that's really good. So that means most of the referrals that are being made are to the right organization for the family. The average response time for organizations to respond to referrals has been 1 day and 9 hours. So again, we're getting a pretty quick response time on people who are making referrals. With our community standards, so these were kind of the standards, these were like the agreements that Iris users agreed to. And we had it that any organization who is accepting referrals, they have to respond to the referrals within 5 days, but we're actually seeing a much quicker response time. So that's wonderful. So far, our top referral collaborators, so the people who are kind of utilizing Iris the most, is Family Focus in Aurora, so their Parents as Teachers program. The King County Health Department, the IGRO Coordinated Intake, so that's like the home visiting program. And then Family Service Association and Elgin. Those are our top 3 contributors right now. And then, let's see, I wanted to show you, we do have this one like data map that was put together. I think I can actually share my screen without, oh no. So there's this really cool data map, and Julia, maybe I can just send it to, oh, never mind. No, still. Okay, let's see. So this is just, can you all see this referral map? Okay, so this is data that we can pull from Iris to show organizations that are making referrals and organizations that are accepting referrals. So we can really kind of see who's referring to who, what services are really being requested through Iris. So it's really, really awesome data that we are able to collect now on different services that are being utilized in our community. So that's pretty cool. Again, you can see court services on here. So they've made some referrals, and we have court services set up with each different program and location. But you can see here, the bigger these arrows are just means that they're sending more referrals. The bigger these circles are means that they're accepting more referrals. So this is kind of cool just to see, to get kind of a map of what the referrals look like in our community. Let's see. And then with Iris, so because we can pull this really awesome data from the system, so organizations who are Iris users, you're able to pull data for your individual organization. The health department is what's called the community manager of Iris. So what that means is we are able to pull data on all of the referrals that are being made through Iris. So that's with that map that you saw, that's something that we can put together to just see kind of how IRIS is functioning. And then we'll have quarterly review meetings where we'll show the data, so we're able to kind of show the progress with IRIS, and then we can also use that as an opportunity to discuss areas of potential improvement for the system. So we want to keep checking in as we're using this to make sure that it's still functioning really well for anyone, for everyone, and if we need to make improvements along the way, we can definitely do that. And then one last thing I want to say about IRIS, because I've gotten a few questions about this. So IRIS is really just for professionals or providers to be making referrals on behalf of their clients. So we've had a few people ask if clients are able to make referrals using IRIS on their own. And typically what we're telling clients, or we're telling individuals, is that we would refer them to 211 for that. So that's kind of a more appropriate resource for them. If they're looking for referrals for themselves, they can call 211 and they're able to get linked with those resources. So this is really just more for professionals to be making referrals on behalf of their clients. So any questions about IRIS? No? And does anybody who's been using IRIS, does anybody have any comments that they want to share or any experiences related to IRIS? Yep, Martha.
You're going to have to, there you go.
Hi, I have a question. Is there a cost to sign up with IRIS?
That's a very good question. So no, there is it's no cost to organizations who are participating. So this is something that the health department has committed to paying for. And this is it's a collaboration between the AOK Early Childhood Network, the Kane County System of Care, which is the Children's Mental Health Grant, and then the Opioid Task Force. So it's a collaboration amongst these three different programs at the health department, and we have committed to paying for this. And we're not going to like trick anyone, like if you use it for 1 year, then all of a sudden next year we're going to say, okay, you need to pay us. That's definitely not our intention. So, so if it continues to work really well for the community, then we'll continue to pay for it. So if your organization is interested in participating, I haven't added my contact information to the chat yet, but I will do that in just a moment. So if you're interested in learning more, we can also do a demo for your organization. So we can really show you what the Kane County system looks like. We can do a demo, we can answer any questions that you might have. So if you're interested, just let us know. Any other questions?
Okay, not seeing any. Thank you, Anna. I thought the video was really, really well. It explained a lot.
Yeah, they do a good job with that video.
Yeah, that was helpful. Okay, moving on to approval of the minutes from March. Those minutes have been distributed for approval. Give you just a minute if you need to pull them up and take a look at it. And do I have a motion to approve? I think so.
I'll motion.
And do I have a second? Make sure you're unmuted.
This is Lark, I'll second.
Great. Any revisions? Hearing none. All those in favor of approving the minutes for March, please say aye.
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 Nays? Not hearing any. The minutes for March have been approved. Moving on to the chairman's report, I can tell you the total expenditures for March were $1,195.26. The total remaining is $39,563.75. Also, the county board representative update. Rochelle just wanted to let everybody know she's still working on that. Any issues or questions for the financials or anything else? Okay, old business. The youth focus group. Julia, can you give us the update on that?
Yeah, so for the rest of the council, so the board of directors is aware of this, but just for the rest of the members, we have been working with a staff member from West Aurora School District who basically has a group of youth that she's convened to help advise the district about issues pertaining to disparities in equity. And so we have been working with her to engage those youth to come and present to the board of directors at our May meeting. So they're going to discuss with the board of directors essentially information that they feel like adults working in the justice system or working with youth that are involved in the justice system should be aware of or would be helpful for them to know. And then any potential recommendations for them or for adults in engaging with youth in our community. And so they all come from a diverse background. So they will be in attendance at our May meeting with the board.
Great. As I move through the agenda, anybody have any questions or any comment, please speak up. The de-escalation videos, I am told there is nothing new to report on that. The next issue for old business is law enforcement training. There was an email vote that was done. The vote passed. I believe that report's been distributed to the board of directors. And the strategies for youth training, Julia, can you tell us about that?
Yes, so this has been an ongoing conversation. So I do have a little bit more information that I got that I would like to share with everyone and the board in particular, because I know, again, this has been an ongoing discussion. So we know that, so this is Strategies for Youth is the agency that would provide a Policing the Teen Brain training for our community. They also have worked with Family Service Association, and they're helping with, or they've provided curriculum essentially for their Juvenile Justice Jeopardy program. So if you've seen events that are Juvenile Justice Jeopardy related, it's the same agency that helps, that puts that opportunity out. So this Policing the Teen Brain training essentially would bring a training of trainers to our community. I'm told that the curriculum that's included in the training of trainers aligns with the requirements that are out there for law enforcement officers coming from legislation, from state legislation. I think I did touch base with Kristen from North Aurora. Sorry, Kristen, to call you out, but I did touch base just to see, and I know I've talked also with Commander Majewski from St. Charles about this in the past as well, about the feasibility of doing this training in our community. We would have to figure out a way to get it approved through the Illinois Law Enforcement Training and Standards Board. But really we would get a, they're telling us that if we can cover $9,000, then they would be able to, they have funding available to cover the rest of the training costs. And that it would provide a 4-day training of trainers class, and then 2 coached trainings within 6 months just to help with implementation. And so really what we would then have is a 2-day core curriculum that can be offered throughout our community of really covering topics that are related to engaging with youth and policing youth in our community. So it's kind of, I guess the benefit to this is that you have just standardized, well, maybe not standardized isn't the best word, but like information that's congruent that would be shared throughout our community for officers that are interacting with youth. So that's kind of a quick overview, but I don't know if there's questions or thoughts, but really what this comes down to is they have funding available to supplement some of the training. It's just a matter of if we feel like we would be able to get the commitment in our community to bring this to our community and see if we should pursue, if we do pursue it, then seeing if the Illinois Law Enforcement, LETSB, whatever, the Training and Standards Board will approve the curriculum. So.
Okay, any questions or comments on that? Julia, what's next regarding that, do you think?
So I'm really looking for comments from the board on what we want to do, or if
I guess one of the questions that I would have, is there a way possibly through the chief of police's meeting or a survey or something, in that we can find out ahead of time whether or not we feel like this is a training that will be supported, that they feel like they can work into their regular operations to send officers to, before we make that investment, I guess, because I would hate for us to supplement the training, and then once we get everyone trained, it's not something that is utilized by a good portion of the police in Kane County.
I guess I would say, I mean, certainly if the Illinois Training and Standards Boards approves it, whether it becomes mandatory, I'm not sure. And definitely, yeah, I'm interested in it. However, with the new, I don't know what you want it, the crime bill passing, there's a lot of training that officers have to get certified in, catching up to that. So not to say that this isn't important, but once all those other trainings that are already mandated, like we don't have a choice, we have to take them by this day or that day, that's already been in place, then perhaps this can get put in. So again, if the training board comes in and says, yeah, mandatory, you have to take it, well, then obviously we don't have a choice at that point. But certainly it sounds like once the, I want to say July 1st, the bill is enacted, that there's training that we have to do. Officers have to certify themselves. They can't certify through the police department. So I know there's a lot of training that we have to get caught up on. And certainly, I think we're open to any kind of, training, but training is difficult sometimes because of shift work and whatnot. I'm not saying that it can't be done, but I know there are higher priorities with other training standards that we have to abide by a certain time date. So
I should add that when I was having this conversation with them, I was asking about doing this training before the end of the fiscal year, since we have that funding secured. So I know that's also a quick turnaround, and to Commander Majewski's points, that would be before the new legislation goes into effect. So, and I don't know if there's a potential for any retroactive if this curriculum would be approved and meet some of the requirements coming down from the new legislation as well. So, I mean, maybe it's worth talking with Alexby about this further. I don't know.
I think that's probably the next step, is to talk to them first to see, one, if it would be something that would even be approved. You know what I mean? I don't know if there's a way to submit the curriculum to determine whether or not it's something that would be approved in the future, so that maybe when the departments work through all the new certified training from House Bill 3653, that then that's something that's an elective in the future, and that determines our timing as to when we do our trainers. But I think we don't want to put a whole lot of effort into it, especially if it's not going to be approved, would be my position.
Hi, this is Kristen with North Aurora. If I can just add a little bit to this, I know there are specific training standards that have been added in for SROs, and as an SRO, it's been a little difficult to kind of get these. There's paperwork we've had to submit, and I think, yeah, to definitely double check with the training and standards boards, because if this is something that could fulfill those requirements for a lot of the SROs in the counties, it could be helpful. But again, we would need that approval from the training and standards board, before we move further, because we don't want to waste anyone's time or money with that.
Okay, not hearing anybody else. Julia, does that give you enough information, at least for now?
Yep.
Okay. Parent engagement, I don't have anything new to report. Restorative passes, I can tell you that the vote passed. The report was distributed to the board of directors. Moving forward, Julia, can you talk about the resource folder?
Yeah, can I add some to the restorative practices conversation? So what's happening, just an update for the entire council, and the board is also aware of this piece, but we are moving forward with the training of trainers in June. And so at the end of April, we're going to offer a 2-day introductory training it's a prerequisite to attend the training of trainers. And there's a couple individuals that are interested in attending the training of trainers in June that need to take this prerequisite. And so we are going to offer that 2-day introductory training. Right now, I've asked for those interested from the restorative practices subcommittee, if they have people they want to send to that training, and then I'll open it up to the rest of the council. I think I'm going to cap that training at 25 because, as you can see, we have 25 people on a Zoom screen here. It's going to be done virtually, and I'm missing some faces on the other screen. So I want to make sure I can see everybody on the screen. So instead of having 45 people, we'll cut it down to 25. And then as far as with the subcommittee and updates beyond just training, we're just continuing to have discussion around how we support the implementation of restorative practices, specifically within school districts, but then kind of extending out into the community. And so part of that is building capacity with training and getting some more licensed trainers in our community to be able to offer the training again within school districts and then out in the community.
Any questions or comments about the upcoming training? Okay, and then Julia, can we move on to the resource folder now?
Yes. So the resource folder came out of a discussion around a potential option for helping spend some of our grant money that we have left over. And so we had a subcommittee that met in March, and we discussed kind of what we're looking for, and really we're trying to make it as simple as possible for the time being. There's potential to have more extended efforts to do more with offering, having more resources available. But really what we've landed on is a simplified brochure that will have information about the juvenile court processes, like a flow chart, have some definitions of common terms that are used in the courtroom. So when families are hearing these terms, they have something to reference. And then most importantly, just resources and phone numbers for any questions once they leave the courtroom. We really wanted to just have some information available to them that they can take with them and have it to refer back to in between court dates, and be able to have point people that they can reach out to if they have additional questions. I don't know if others who are were a part of that discussion, if they want to add anything.
Okay, hearing nothing. And Julia, can you also, as we move on to racial and ethnic disparities, give us an update?
Absolutely. So the racial and ethnic disparities team or subgroup or subcommittee, whatever you want to call us, we met in March and looked at the data that we received from sending out that law enforcement survey. We had a lot of good information that we got from it, and so kind of we narrowed our focus or the conversation into having more strategic discussions, really to explore issues related to adolescent domestic battery in our community, since that seems to have been really a long-standing problem that we've been trying to figure out. So more to come on that, but that's kind of the progression that we've made. But definitely a lot of good information and insights from that law enforcement survey. And then also related to racial and ethnic disparities, we are doing a presentation with the Center for Prevention Research Development with the University of Illinois, who provides data from the detention center to our funding source, the Illinois Juvenile Justice Commission. So they're going to do a presentation on the data that they have available related to our county on May 12th from 12 to 1. So if you're interested in attending, just let me know, and then I will get the link out to you. We also need to approve this for the board, so there will be an email vote coming to get that, make sure we get that date secured, but that is the data presentation.
Okay, then we'll keep moving forward. The individual meetings, just letting everybody know, Julia will continue to do these as time allows. They're likely going to continue into the new fiscal year. Regarding current expenditures, still have a significant amount of funding available. Want the board to note the email vote likely coming requesting funding to renew our Zoom subscription so we can keep meeting, I guess. And anybody have any needs in the community that think could be addressed by the excess funding? Any questions or comments about that?
Is there any way to request a rollover? Isn't that what happened last year where because of COVID, you were given extended time to spend the money or no?
No, they didn't give us extended time to spend our money. They just continued our grant. So we were able to get access to more money for this year. It was considered a continuation instead of a competitive grant. So they have strongly said no for the rollover.
All right, I think this is something that, you know, people should think about, or if you come up with any ideas to send Julia or Rochelle an email. And the next item is the book club. Julia, can you tell us about that?
Yeah, so this is the board kind of put a pin in this and just wanting to revisit this discussion. The idea being that we would select a book that really is related to any relevant topic impacting youth. But I think my initial idea was really around some of the equity conversations books. That there's a lot of great books out there that can help educate about some of the issues that are going on related to equity. And so what this would be is those that are interested could read a book together and then have a discussion. I know we've talked with some of our partners about being able to offer professional development, continuing education credits, whatever, depending on your discipline. And we could also offer this virtually. So just revisiting this idea, if this is something we want to pursue, or if we want to, put it in our grant application for the coming year, that this is something we're going to pursue and do this either way.
Any comments or questions about that? Not hearing any. So the 2022 grant, it's due May 19th. I let everybody know Julia will be working on putting everything together. Anyone who's interested in helping would be welcome, as well as any input around any of the priorities for the grant. As a result of some of the discussions with the commission over the past fiscal year, Julia will be revising the RED plan and the JJC plan, which I don't know what that means, but Julia, can you tell us if everybody else knows what that is?
Yeah, so I can so I've had different formatting for our JJC plan and our racial and ethnic disparities plans over the past years to kind of narrow our priorities. So I want them to be tools that we can use in our meetings, have discussions, and really use them so that members know where we're at, where we stand with our priorities and our efforts. So I'm really going to make an effort to try to revise those and again, like narrow the scope of them, because they've been very broad historically. And so I want to work on those. But in the meantime, between now and May 19th, you will find me hunkered down, probably working on that grant, among other things. So I do welcome any support, any input, ideas for that grant application.
Okay. And new business success stories. And I know this is on the agenda, and Julia, you might want to help me out. Is this something that they can submit to you, or that if people want to talk about a success story that you know right now, that would be great.
Yes, I'll just add. So it was a request from our funding source, the Illinois Juvenile Justice Commission, would like any success stories that we can share with them. It's probably, you're welcome to share them now. I mean, I think we could all use some. It's a rainy day. We could probably use some success stories to restore some, hope in our days. But if you want to submit them to me as well, then I can pass them along. But it could be from a youth or family, like that direct service level. It could be as an agency or even in the community if we've seen some success happening Just wanted to put that plug out there. It could be at any level. It doesn't just have to be with a youth and family.
Anybody want to share today? Okay, get those to Julia. I think that would be helpful. And the next is open for discussion. So if we could get some input on any juvenile trends, things that you are seeing in the community. Certainly these are unprecedented times, and we know that the youth is dealing with a lot right now. Any trends or comments about what you're seeing? Everybody, no one's got anything to add. But I think that's something that should be discussed. If we can think about that maybe and share it with what's going on now. We can move on to legislative updates. I understand those have been distributed. Any other updates from any member of the council that you think we should be discussing or should know about? Okay, still not hearing any. Then I will move for adjournment. The next Board of Directors meeting will be May 13th, again from 12 to 1. It'll be via Zoom, and I got on here the King County State's Attorney's Conference Room. Can Lark or Julia talk about that? Is that standard?
It's standard.
Okay.
But we're really just doing them virtually. So
okay, that was on here, and I didn't know if that
nope,
was
sure.
something separate.
Nope.
All right. Do I have a motion to adjourn? You have to be unmuted.
Can I bring up one thing? 1 second.
Absolutely.
I'm sorry. The legislative updates. It looks like SB 2385 is, and I don't know if the SAAs have heard or ASAs have heard about potentially raising the age of juveniles again. I feel like we tried this once. I thought I saw something about, and I think it was some of the actions for change in the Loyola University did their the webinar. They had a document added on, and I thought it was 18 to 21-year-old will be treated as juveniles for misdemeanors. And then, I'm assuming for felonies, they'd be treated as adults. I don't know if any of if Lark, you can comment. I feel like we already tried this once with the 17-year-olds, and it's a disaster. To have a 20-year-old charged as a juvenile for a misdemeanor, I don't know why. I feel like 18 is perfect. It's 18 for a lot of other things, cigarettes, right? Well, not cigarettes anymore. A lot of other things. I guess what's the possibility that this is going to take place? And the thing I'm referring to, it says SB 2385, a delinquent minor also raises the age to 21 by 2024. So I don't know if you can comment on that.
It looks like LaTanya might be ready to make a comment.
I can only tell you some of the conversations that we've had. This is only, I wouldn't say rumors, but in various meetings from various groups. This is something that's been brought up pretty much every year. There's been some discussion about raising the age. It is always aligning with raising the age of detention. So it is all these overlapping conversations. We are hearing that it's picking up some steam. That you never know what's going to come to pass with that. I think it's coming a lot from those discussions about emerging adulthood and brain development. Yeah. There are concerns that have been voiced across the state, because if you raise the age, that then has older kids in detention with younger kids. So again, that's why those conversations are overlapping with the age of minimum age of detention and all of that. So it's just one of those things. There are some groups out there that are really pushing this agenda. And I think until something changes, I think we're going to see some type of legislation around this probably every session.
Yeah, I would agree with that.
I can't tell you if that's moving this session, but I would keep it on your radar.
And I would further predict it's going to get there. Like, I don't know that it's going to be this session, but at some point the juvenile age will be 21. I am fairly confident in saying that. I just don't know the timing. My only hope is that we don't do the split. Like if we're going to do it, just do it.
I agree. The split was an absolute nightmare. Didn't really accomplish anything. And I know it was kind of well, let's see how this works. you
Yeah,
know,
it was,
but yeah, well, I don't know, it was detention facilities. I understand that, we don't want to put youth in detention facilities, but I mean, with the youth detention facilities have to get bigger. You have 4 more years of kids. You know what I'm saying? Arguably, potentially, they would have to be housed in another facility. I know that's kind of way down the line, but I don't know how that happens. DuPage doesn't have a facility.
I saw Mike appear, so my guess is he's got some comments.
It certainly presents challenges. You talk to a lot of sheriffs around the state who run jails and ask them who they have the most problems with in their population, and it's the 18 to 21-year-olds. So, if it comes to pass, we'll deal with it then. Excuse me. I will say that there's also another Senate bill regarding 12-year-olds not being detained, and it is also gaining momentum.
Yeah.
And we support that. I don't think that 12-year-olds should be in detention personally.
I'll also add to this conversation. I didn't include it in the legislative updates, but there were a couple bills too that were proposed talking about even just the treatment of young adults. And I think it was beyond just 21. I think it was almost up to 26, kind of to be consistent with like in court decisions and how we're sentencing them, being consistent with adolescent brain development. And acknowledging that their brains are not functioning at full capacity.
There's a case the Supreme Court's been considering for about a year now. I think they took it in January of 2020. That depending on how they decide that, it's talking about expanding those juvenile sentencing protections to young adults over the age of 18. I think depending on how the Illinois Supreme Court comes down on that, we'll have some impact on where some of these other bills go.
So just for the record, it's Senate Bill 65, House Bill 3767 that talks about raising. Currently, we can take kids as young as 10. There's very few throughout the state. I don't think we've ever had a 10-year-old in Kane County, but occasionally we have a 12-year-old, and both of these bills would raise the age to 13. So then the question becomes, if a kid commits a serious offense, because it happens sometimes, and DCFS, CCBYS is not able to place the minor, where do they go? And I'm involved with a lot of committees that are having those conversations right now. And so is Bernie. I see her down there in the corner.
Thank you for your comments.
So that was good information. Anybody else on any topic want to bring anything up before I move again to adjourn? No. Okay. Do I have a motion to adjourn?
I'll move. This is Lark.
Thank you. Do I have a second? Okay, I have a second. Meeting is adjourned. Thank you very much. Have a good day, everybody.
Thank you.
Thank you.
Thanks, everyone.
Thank you.
Thanks, Julia.
Thanks, Brenda. Or Lark, who said that? I don't know. Did Lark say
Brenda
that?
did.
Brenda did, okay.
But
I'm
also
like,
thank you, Julia.
I know, I just was like, wait, Lark's
Thank
there.
you.
Thanks, Martha. There's Brenda.
Bye.
All right, take care.
Bye-bye.